you prepare yourself on the next podium. Okay.
Good afternoon to one and all present here. Today I am presenting my paper on intraoperative floppy iris syndrome, a comparative study on use of intracameral adrenaline and low parameter phaco versus iris hook and Malyogan ring in patients undergoing cataract surgery. There is no financial disclosure. Now what is IFIS? Intraoperative floppy iris syndrome is characterized by three intraoperative features, which is flaccid iris stroma, a propensity for the floppy iris stroma to prolapse towards the phacoemulsification and side port incisions, and progressive intraoperative pupil constriction despite standard preventive preoperative pharmacologic measures. The conventional methods of pupil stretching and partial thickness sphincterotomies worsens the situation of achieving mydriasis. Hence, in this study, we have attempted to determine whether epinephrine injected directly into the anterior chamber would be beneficial in these IFIS cases. The aims and objective of this study is to compare the safety and efficacy of intracameral adrenaline and low parameter phaco versus iris hook and Malyogan ring in intraoperative floppy iris syndrome patients undergoing cataract surgery, and to compare the final visual outcome in both the groups. It is a retrospective study, and cataract patients with a recorded IFIS of any severity occurring over this period identified and enrolled in a multivariate analysis. The study duration is 1 year, and it is a single surgeon setting. Group 1 consisted of IFIS patients with cataract removal using intracameral adrenaline combined with low parameter phacoemulsification, which included aspiration flow rate on the range of 15 to 20 cc per minute, vacuum up to 250 millimeter of mercury, and 60 to 70 centimeter of bottle height, and high viscosity OBDs like Viscoat. In group 2, we put the IFIS patients with cataract removal using iris hooks and Malyogan rings. Now 80 patients were in group 1 and 43 patients were in group 2. The final visual outcome was determined and compared between the two groups based on best corrected visual acuity, posterior capsular rent incidence during surgery, and other complications like iris injury, bleeding, sphincter tear. Now here I presented 3 videos. In the first video, we can see the use of intracameral adrenaline with low parameter of phaco. The parameters are already written in the right side. And then the phacoemulsification is carried out. In the second video, I've shown the insertion of Malyogan ring and then continuation of the phacoemulsification procedure. In the third video, I have seen the use of iris hook, 4 iris hook, and then continuation of the surgery. And after that, the PCIL is implanted in all the 3 cases. So in the first case, we have seen that the intraoperative pupil constriction is lesser with the use of intracameral adrenaline and low parameter of phaco. Now coming to results and observations of our study, IFIS was observed in 123 out of total 610 eyes, which is in a study duration of 1 year, which amounted to 2% of the total cataract patients. And the causes of IFIS was found to be maximum due to tamsulosin use, which is used for benign prostatic hyperplasia, and this is again the other causes were use of other benzodiazepine use like psychiatric medications and other antihypertensive use, and some idiopathic causes. In our study, males were found to be more affected with IFIS than females, and the mean age duration was 70.5 years. Now this is a correlation of tamsulosin and IFIS in both the groups, and we have found that in both the groups the tamsulosin use was the most common cause of IFIS. The mean preoperative pupil diameter was 5 mm in this study. However, the mean preoperative pupil diameter in group 1 was found to be 5.5 mm, and the mean preoperative pupil diameter in group 2 was 5 mm. Use of iris hook or Malyogan ring provided stable intraoperative pupil diameter, though there is a risk of iris trauma. Sphincter tears were found to be more common with the use of iris hooks. Malyogan device was faster and easier to insert, though there is risk of endothelial injury due to the girth, rigidity and manipulation in anterior chamber. The PCR incidence was found to be more in group 2, that means with the use of iris hook and Malugan ring. And other complications like iris trauma, bleeding, sphincter tear, iridocyclitis, and cystoid macular edema was also found to be more in the group 2 patients. So, coming to conclusion, the early diagnosis of IFIS reduces intraoperative complication rate and affect final visual outcome. And perioperative users of intracameral adrenaline and low parameters was found to be safe and with good efficacy and cost-effective for cataract removal in IFIS. Thank you.
That the adrenaline you get how many minutes you have the effect when you inject it? How many times you inject before completing the case?
So before the completion of case, sir, after the wound construction, we put the intracameral adrenaline, and then we proceed with the surgery. So the the duration of the surgery will be like 5 to 10 minutes, sir.
Usually the IFIS cases, the iris will be very unstable coming to the wound. And how does the adrenaline prevent that?
Sir, actually adrenaline with lidocaine combination.
Can it dilate the pupil?
Sir, it can actually maintain the intraoperative pupil mydriasis, which is not possible with atropine or other pharmacologic measures, sir. And it has been studied with sugarcane solution also, sir. In sugarcane solution, we have used like BSS plus lidocaine and intracameral adrenaline. So here we have used just intracameral adrenaline, lidocaine, same BSS, not BSS plus.
There are two concerns in the IFIS one. One is pupil size and second is pupil iris prolapse. See, the pupil size you have taken care of with adrenaline, but once the pupil dilates, then chances of iris prolapse become more.
So for iris prolapse, sir, in IFIS cases, so we have to make a longer incision. So that will prevent the iris prolapse through the phacoemulsification and the side port wound. So that intraoperative measures will have to take, sir. Which is not included in this study, sir.
Longer incision will invite more iris.
Shorter incision will, sir, cause iris prolapse, sir, mainly.
I think you are telling just the other way. And have you tried doing a peripheral iridectomy to prevent iris prolapse?
No, sir. In this study,
any other, say, pupil dilating device other than Malugan ring and iris?
No, sir. Only iris hook and Malugan ring, sir.
Have you tried phenylephrine injectable intracameral? Have you tried this?
No, sir. Epinephrine, sir, in this case. Strength, sir, 1:4,000.
Not strength, but phenylephrine injectable.
No, sir. In this case, we have not used, sir, in this study.